Do you believe that sometimes doing less is better for your health, especially after age 70? Welcome back to Senior Life Joy and Wellness. I am your health expert, and today we're going to discuss a sensitive but vital topic. Common medical tests you should seriously question after age 70. For years, we've been taught that prevention is key, and the more tests you do, the better. But what if I told you that some of those routine screenings once life-saving in your 50s now carry a greater risk of harm, stealing your peace of mind, energy, and even your independence? This information is based on the latest recommendations from top medical organizations. Join me as we explore 5 tests you should refuse or replace with smarter alternatives. Disclaimer at the start. Please note that the information in this video is provided for educational purposes and does not substitute professional medical advice. Our goal is to help you become an active partner with your doctor. Any decision to change your screening schedule must be consulted and confirmed with your physician or healthcare professional. This is the story of Mrs. Eleanor from California, 75 years old. A woman who always followed every piece of medical advice. She diligently went to her checkups and completed every requested test. But after one particular screening, her life spiraled into a cycle of anxiety and unnecessary treatment. Mrs. Eleanor's story perfectly illustrates the dangers of overdiagnosis and overtreatment, the two silent threats of old age. 1. First mistake: routine mammography screening after age 75. This is one of the most widely recognized screenings. However, after age 75, the benefit of continuing routine mammograms significantly decreases while the risks increase. The danger of overdiagnosis at age 75 and older: if a breast tumor is found, the likelihood of it growing so slowly that the patient will pass away from another cause, like heart disease or stroke, is very high. According to recommendations from the U.S. Preventive Services Task Force, there is insufficient evidence to recommend routine screening for women over 75. When doctors find small tumors often harmless at this age, it often leads to unnecessary biopsies, causing pain, stress, and risk of infection, surgery, and radiation, leading to fatigue, loss of strength, and a major negative impact on their quality of life. The smarter choice: instead of annual screening, discuss your life expectancy and overall health status with your doctor. Prioritize an annual clinical breast exam. The goal should be to look for large, palpable tumors, not microscopic ones. 2. Second mistake: routine PSA testing for men after age 75. The PSA prostate-specific antigen test is a blood test used to screen for prostate cancer. Like breast cancer in older women, prostate cancer in men over 75 is often the slow-growing type that is not life-threatening. The real danger: the PSA level can be elevated for many non-cancer reasons, for example, inflammation or benign prostatic hyperplasia. An elevated PSA often leads to costly and painful biopsies, high risk of infection and bleeding, interventional treatment, surgery, radiation, causing unwanted side effects such as erectile dysfunction, and urinary incontinence consequences that can destroy the colon for an older man, even though the tumor might never have harmed him. Credible source: the American Cancer Society (AX) advises that PSA screening should generally stop between the ages of 70 to 75 for most men. Unless they have a strong family history, the smarter choice: opt for active surveillance instead of immediate intervention. If the PSA level is high, discuss monitoring without an immediate biopsy. Prioritize protecting your quality of life, independence, and avoiding unwanted side effects. 3. Third mistake: colonoscopy after age 75 to 80. Colonoscopy is the gold standard for colorectal cancer screening, but its benefits are reversed in the very elderly, especially those with a life expectancy of under 10 years. The physical danger: this is an invasive procedure requiring sedation and complex bowel preparation laxatives. Studies published in the Journal of the American Medical Association show that the risk of complications in people over 80 triples compared to younger individuals, including bowel perforation, a life-threatening risk requiring emergency surgery. Sedation complications, causing confusion and cardiac arrhythmias in people with pre-existing heart conditions. The risk versus benefit principle: if you are over 75 and have never had a colonoscopy, weigh the risks carefully. If your projected life expectancy is less than 10 years due to other existing conditions, heart disease, COPD, the risk of complications from the procedure may outweigh the benefit of detecting and curing cancer in time. The smarter choice: discuss less invasive screening options with your doctor, such as the fecal occult blood test, FOBT, or the fecal immunochemical test, FITDNA. They are not as precise as a colonoscopy, but they are much safer and sufficient to detect serious issues. 4. Fourth mistake: unnecessary full-body scans and cardiac screenings. Many older adults request full-body CT or MRI scans to find everything or ask for routine cardiac stress tests even when they are asymptomatic. The danger of excess data. These tests often produce false positives, finding minor abnormalities that are not life-threatening. For example, small nodules on the lungs, kidney cysts. Credible source, according to the American College of Cardiology, ACC. This leads to a chain reaction, extreme anxiety, follow-up tests, and sometimes invasive procedures to confirm something unnecessary. The danger of stress tests. Exercise stress tests can increase the risk of a cardiac event in individuals with undiagnosed heart problems. If you are asymptomatic, no chest pain, no shortness of breath, the benefit of this screening does not justify the risk. The smarter choice. Talk to your doctor about using cardiovascular risk assessment tools like the Framingham score or ASCVD risk estimator instead of invasive tests. Prioritize checking and managing lifestyle factors, blood pressure and cholesterol, the factors you can actively change. 5. Fifth mistake. Pursuing overly strict blood sugar cholesterol targets. This mistake is not about the test itself, but the target. In youth, the goal is to keep HbA1c below 7.0% and LDL-C as low as possible. But for the elderly, especially those who are frail or have multiple conditions, this goal can be harmful. The danger of overtreatment, driving blood sugar to low hypoglycemia, or blood pressure to low, can lead to falls. Sudden drops in blood sugar and blood pressure are leading causes of dizziness and falls, which are the single greatest threat to an older adult's independence. Medication side effects. The side effects of high-dose medications required to meet strict targets can sometimes be worse than the disease itself. Recommendations from the American Geriatric Society (AGS) suggest that for frail seniors, the primary goal is to prevent acute events, stroke, heart attack, falls. Not to achieve a perfect lab number. Prioritize quality of life and independence. Dear friend, after age 70, the goal of medicine is no longer to prolong life at all costs, but to maximize your quality of life and your independence. Don't blindly adhere to outdated protocols. Become an active partner with your doctor. What question will you ask your doctor during your next checkup? Please comment below. I want to hear from you. If this video helps you make a wiser decision, please share it now. Hit the subscribe button so you don't miss our next life-saving content.